Hi, everyone. I'd like to do a shout out to our sponsor, Bako Diagnostics. Early detection is the single most important factor in improving patient outcomes. The Bako Diagnostics team recognizes how impactful a podiatric physician can be and remains committed to supporting you in your role as the first line of defense in diagnosing conditions of the lower extremity. Thanks to the unwavering support of their clients, Bako Diagnostics has been able to give back to the podiatric community for 16 years by providing podiatric educational resources and advocating for the position. Bako Diagnostics, helping podiatric physicians keep America on its feet. If you have not yet had the opportunity to utilize Bako Diagnostics services, get started today by sending an email to corporaterelations@bakoddiagnostics.com. The first 50 podiatry offices who request a starter kit will receive a Dean's Chat mug. Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the co-host for the Dean's Chat podcast. Once again, I'm joined by my co-host, Dr. Joanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I'm doing fabulous. Joe, I wanted to let you know I got all those Girl Scout cookies in my office today.
Excellent. It was a very busy weekend of Girl Scout. In fact, we have more Girl Scouts tonight. So we are in the thick of it for Girl Scout cookie season. So, but I have to say, I'm so proud of them. Both my youngest and my oldest they're really into it this year, which is cute. Because I told them I am not selling these. These are not my cookies. So it's been great.
Nice. My problem is if I open some Thin Mints, I have to eat them all.
I know. Well, a serving's at least 4. The other cookies, it's like 2. And I'm like, that's not even a serve. That's like a snack.
No, fair enough. Fair enough. Well, Joe, we have a phenomenal guest today. I'd like to introduce the new dean from Broward University, Dr. Madelin Ramil. Dr. Ramil, welcome to Dean's Chat.
Thank you. You guys are so nice. Thank you. I appreciate it. That you even invited me and that I get to be a part of this today. It's exciting.
Oh, no, and I'm remiss in not inviting you sooner. I don't mind sharing with our audience that this morning we had a cancellation for this afternoon's recording, and I texted Madelin. I think it was probably 5:30 in the morning here in Arizona, and I thought, there's no way Madelin's going to be able to do this. And then you texted back and you said you wanted to, so we're very grateful that you are making the time to join us.
Good. I'm glad it's going to work out.
It will. All right. So Broward University is one of my favorite places on the planet. As you know, I was there 15 years ago as the dean. And it's just a phenomenal environment, a wonderful educational environment. And I was so thrilled. Oh, Madelin, by the way, we go first names on Dean's Chat. Madelin, Joe, and Jeff.
Oh, very good. Okay.
Yeah, that way we can skip the doctor stuff.
Great.
Anyways, I was so thrilled when you were announced the new dean at Broward University. I remember when I was there, you were at the university. I think we went to some white coat ceremonies together. Yes. And I was always pushing our students to go do their clerkships at Westside, where you were with Dr.
Great.
Spinner. And Joe, as you know, I always tell our students in Arizona, if you do the Florida swing, Westside's one of the top on the list for sure. Absolutely. Yeah. And some of our favorite students have gone there over the years. And so maybe to kick it off, first thing I'll ask you is what's it like? You've been there how many months now?
Well, I started September 15th, so truly we are 4 months in.
Wow. So 4 months is kind of fast. I'm sure sometimes it goes by fast, sometimes it goes by slow. But what's it like to be the dean at the podiatry college that you graduated from?
Well, I can tell you it's very different, obviously, from practice. I am enjoying it more every day because I'm settling in. So now names become familiar, students become more familiar to me, and that was important to me. But more so, I'm getting a handle of how, the administrative university works. It was tough and overwhelming at first because everything is brand new. And I can sit and talk podiatry all day, but not really the administrative portion of how the daily operations of a school. And now I really I'm feeling comfortable. I do believe that I'm quite fortunate because both everyone above me at the university level and all of my faculty the staff and the students, they have really made me feel very comfortable. I think there was a lot of talk around town where they were thinking that, what's going to happen? What's the change going to be? So there was a lot of that, unknown, which is normal for everyone. We're human beings. But I think, as they've gotten to know me, they know I want the best for our school. I'm going to fight for this profession hard. We need people to fight for our profession. I'm a believer in what I do and what I did for a living that sustained me. I made a difference, in the world every day. You touch people in so many ways. And now I think I've started to do that with our students. So it's pretty exciting.
That is exciting. Jill, one of the things I wanted to bring you in right away and talk about is you came into academics out of practice. I went into academics after almost 20 years of practice. What are your thoughts, Joe, on the transition from practice into an academic environment?
Yeah, I think it's such an important part of what we do, especially now. So, I've been in academics for 15 years or so, and what is different now than it certainly was 10 years ago, but definitely 15 years ago, our students can find anything they want to find online faster than I can explain it to them in 6 different formats to appeal to whatever their learning style is. So that's not really what they need me for. What they need me for is someone who's lived these things, someone who's done this, has experience in one of these parts of this video that helps them understand why certain parts maybe matter more than others. What are the foundational rules? And when can you bend something? When can you break something? And what is the non-touchable, right? And so what I would love to hear from you, Madelin, you have had such an incredibly impactful career. One of my favorite people is Diana Rogers, and she speaks so highly of you and all of the time that she got to work with you. With 25 years of practice, especially in something like teaching in a residency program, what have you found to be the biggest difference between teaching in that clinical world and then trying to translate that into a very early learner? What has been coming in with a new lens, a fresh perspective? And then what has been a little bit challenging?
So the most challenging, I think, was the transition of, as physicians in the real world, you have a patient and you put an action plan together. And the minute you're diagnosing, you're already thinking of, what am I doing? So that plan of care starts to roll immediately, and you immediately put it to work. You are in charge, and you don't ask anybody permission other than going through the norm of the insurance world and the authorization for the MRI, CT, or whatnot. You furthermore make phone calls. I was the one that had everybody's cell phone, and if it was the cardiologist because the patient's in congestive heart failure, or the endocrinologist, whoever it was, I called them. I'm like, patient's on the way into the hospital. I am admitting them. I'm bringing you in for a consultation. So it has been the most difficult transition for me, has been in private practice. You immediately have an action plan. In this role, you have an action plan that is very dependent on many, many other people. So first, communicating with everyone that is affected, whether it's the student, the class, their e-board, even that has been a learning experience. You don't speak to the class before you speak to their e-board, and then they have some curricular person that represents the class. It's very funny at the student level, but then you have the university level. You have got to go through a chain of command. And though it is easy for me and for doctors to follow chains of command, because that is the way our training was, right? You were a student, then you were a resident, you were only a first year. When you were that senior chief resident, you finally arrived. But all along, there was a chain of command. You answered to your second year resident, your third year resident, or your attending. Now, when you get to this level, I answer to the university. And if I want to put something in action, I have to communicate, and you no longer can do this as I did on the phone. Hey, I want to do this. Hey, yes, no. So now it's very important to document who you send this information to. And actually, Joe, at first, it was so overwhelming, me putting together like this entire plan for 50 different projects going on at the same time, that I would use Post-it, and I would put Jeff, I put a date and a color, Joe, yellow, and so prioritizing, and then trying to keep up with who you were going to communicate with and what was more important. And sometimes that project that I want to put together required the associate dean and their assistant and the university's accommodation, department for a special student. It came from every direction, and trying to figure out how quickly I can get that. I learned very quickly that it doesn't happen overnight. It can actually take, unfortunately, days and sometimes weeks. That was extremely overwhelming, because then I'd okay, now I have another project, but I have to remember the other project. So I had Post-its everywhere. And as things were getting done, I was removing, little pieces of notes that I had posted everywhere, and then I'd sort of throw them out. I don't want to go off tangent, but I feel that's been my biggest thing to overcome. With regards to coming in from private practice, I feel every day, and the reason why I went into this position and why I wanted to give back is because I said, I can't die with all this knowledge I have. And I share it with my 9 residents and then the few externs. But I always felt that I was always, if I would be put in front of grand rounds, students were like, their eyes are open and they're hungry and they want to hear more. And I feel that coming in here, even though I am their dean, they still look for me, to me for direction. And because I am so involved with them, I am making all their meetings, I do their extracurricular activities at night. Right now, these students are my kids. I need to know how they run, what they do, what they don't do, who's around, to really put this story together. But every time I open my mouth, it's like they all just sort of sit and listen and learn. They're captive. I'm captivating them, which is pretty exciting. And it seems like every single time I'm talking about something administrative, I always go and refer back to that practice and back to that time with a patient. And I give them so many examples, whether it's diagnosing, whether it's, how you beat the insurance out to make sure that this patient gets what they need. I don't think I could do this job without doing what you and Jeff did, having had this incredible clinical experience in the real world of medicine, and then bringing it back to share with them.
I totally agree. Jeff, I'm curious what it was like for you coming in. The time management thing, I'll be honest, I've been I still work clinically, but full-time academic professor status. And I'm still trying to figure out time management, because there are to your point, you put this project in motion, and sometimes if it's a research, you're talking months sometimes to get all the balls to roll in the right alignment. And so that space, then you start filling it with other things. And then suddenly, at one period of time, everything comes all at once, all at the same time.
Absolutely.
So I've learned to schedule better white space in my schedule. But Jeff, I'm curious what it was like for you, because you also did the thing coming from a very busy clinical practice into, if I'm not mistaken, completely academic. Was that correct?
Yeah.
How did you figure out that time management?
It was difficult. It was complete immersion. I'm sure you're experiencing that, Madelin. To quote Mike Treppel, when you give a dean job description, the description simply reads "whatever it takes." and
So true.
So I to answer your question, Joe, I'd always been a morning person. I'm still a morning person, but I used to get up early and do all my emails and everything that I thought I needed to do for the day because I never knew it was going to hit me during the day.
Mm-hmm.
And I found that to be very productive because it just that was the nature of the job. And then being a dean is kind of like being in the service industry. You have to be available when other people are available.
Right.
And students are in class, they're in clinic, in their third and fourth year, they're in clinics, they're in class. And so you got to be available before class, at noontime, and then after. So I found it to be an interesting shift. But the cycle, to your point, Madelin, patient cycle is decision, decision, decision. And then there's this rolling sequence of, it's repetitive, granted, over the course of a year, but it took me a while to get used to that. And in fact, one of the previous provosts, Dr. Linda Peterson at Barry University, one day I was in her office and I was asking her all these questions because I had too many things on my plate and I was juggling and I didn't know what was most important. And she said, "Jeff, you got to slow down a little bit. This isn't like being in practice. There's no emergencies in academics." And I thought about that for a second, and I thought, yeah, you know what? I can sleep on this if I want. I can ruminate about it. I can make a decision in 2 days. It doesn't have to be right now. And then I thought that helped me, Joe, that perspective. And then, and this interview isn't about me, but I wanted to add one more thing, that I had some tremendous mentors. Dr. Jeff Page was here at Arizona, and he was one of my mentors going through school. And I would call him all the time, and I'd say, "I have an issue here. What do I do?" And that worked out great. And Dr. Treppel was very gracious. All the deans were great. And over time, I think, Madelin, to your experience, it took a few months just to settle things down a little bit. But I didn't want to make any decisions because I didn't know what I didn't know. It was hard at times. So I'm always weighing that out. So Madelin, I'm kind of reliving your experience listening to you talk.
Yeah. Yeah. Well, I can say, Jeff, that I needed to make decisions quick. A lot of changes have taken place before 3 months because, as you well know, we closed down on or about the 18th of December and everything shuts down. And so we had all of these university deadlines that had to occur before we shut down. And that affected, what I had to do. So as much as I've always been a morning person and I'm up before that alarm goes off at 5, I'm usually looking at the clock and it's 4:59. It's so crazy, but that was my normal life before. Now I've added the commute, which is heavy traffic, but I'm a morning person. So I definitely get into the office initially for the first, oh my goodness, month. I was in the office at 6 a.m., which means I already commuted for an hour. And it was crazy. And I wouldn't leave until 7:30 or 8 o'clock at night. And I arrived at 6 and I'm like, is this what I have to do for the rest of my life? But I would ask myself that. And just like you mentioned, Jeff and was introduced to me by Dr. Steinberg John, which I super admire, love. He was a classmate of mine, and he introduced Jeff and I, and I have called Jeff on various occasions. He's always been there for me, and I can't thank him enough for giving me that guidance. And through his mentorship, I also had Dr. Evans. Chet Evans was a very the longest dean at Barry. And I called him for his blessings. And I said, be frank with me. Chet, I want to know, is this for me or not? And he is like, are you kidding? This has your name all over it. And so I have him. And right now I'm super lucky because Jeff knows Jack Nelson. And Jack Nelson was our dean of clinics when I was in school, and he has been dean of the school and associate dean of clinics. And he's been an adjunct, and I was told that he's been retiring for years, and he is now serving as interim associate dean of clinics for me. And it's so amazing and refreshing to have him sit with me. And as we look at this curriculum and, we're making changes, it's incredible to see how Jack did it for all those years, how he applies it to today. And he does admit, he is like, wow, Mad, we used to think we were busy, but things have changed and you were busier than we were. And, he talks to me about they went and worked out in the morning, Dr. Evans and himself, and they went for breakfast, and every day they met and spoke, which I think is fabulous. I do this with him now. And then he said, and then we went to lunch, and then every day we would catch up, which I think is so important. And I have that with him and our Associate Dean of Academics, Dr. Aloma. But it's just, I tell them all, I said, this is an open door policy. Like, you guys need to just come in and go, hey, Mad, I got this. And there are so many things that come up every day, like Jeff said, that are so unexpected and so, student driven. I would say a lot of academic affairs that need my attention and you need to stop. But somehow my immediate staff at first would say, Dr. Ramil, you can't see them. The students are there. You can't see them. You can't see them. I'm like, what do you mean I can't see them? I need to see them. I need to know what's going on, And so I would drop something I was doing just to bring them in. And so I think things have settled in. I think students at first just made appointment after appointment. They're like, we're just here. We want to meet you. This is what's on our mind. We don't think this has worked. We want you to think about this. And in all honesty, these are adults. They're going to become physicians. And I tell them, in a few years, you are a doctor like me. We are going to be colleagues. And you need to hear them out, because many times they're the ones going through this daily ritual that may not be working for something that has a simple solution. And I will always say, okay, if you're complaining, what's your solution, right? Give me ideas. And I think that works really well. Don't come and complain every day, but if you have a complaint, how do we solve this? What's your idea?
Yeah.
And it works. And I think when you bring a lot of minds together that care, you find a solution together, and nothing better than that.
Oh, I agree.
Oh man, I love that.
I do too. It's so interesting because we did interviews today, Madelin, and at the school, and we were talking about the basic sciences and the courses and then the clinical work and the podiatry specific tracks, if you will. And I made an admission. I said, look, I can't help you in biochem, but I can help you get the right clerkships and apply to the right residencies and grease some skids that way. So our roles change as they go from first, second, third, fourth year. And I think it's so fun. The kids are great. The students
and
are
you
great.
know what? I got to tell you, it is fun. I am now starting to enjoy it. And I know that I'm going to enjoy it more so, as the time progresses. But you are absolutely right. And the other thing I've noticed too is I came in the middle of a fall. I also came in the middle of a year where there was an academic calendar. And there was a syllabus in place. And even though we wanted to make changes, I have to respect, until it's over for us to make those changes. And so I'm going through a whole spring. It's a cycle. Different things happen in the spring, as you well know, right? And then I'll have to learn the summer. And then I can't wait to start the fall, because I wasn't there to be a part of that initial new class. I missed all of that. So I think once I've gone through a year of a cycle, I'm really going to feel even better than today, you know?
Yeah, that I think that's true. Well, like any job, you get immersed in it. And Joe, I remember when you joined us at the university, and Joanna had all these great ideas, and we saw a lot of them through to fruition, right? A bunch of research projects and things. And Joe took over our surgical program, which she also taught at Samuel Merritt. So I mean, it's just time flies though. These cycles go by fast. They seem slow the first year, but
yeah. I agree. And now, I mean, here's my cycle, and I'm going to my first dean's meeting, Jeff. So I'm a little nervous, but I'm a little excited because I want to see what it's like and I want to learn. And I can't wait to pick everybody's brain. So
that's only a week. That's that's less than a week away.
Yes. That's Sunday, our first meeting.
We're all converging on Vegas.
Yes. Yeah, that could be scary too.
No, it'll be, you're going to have a blast. You're going to have a great time. It's really a time when all the deans can get together, and the Sunday night meeting isn't an official meeting. It's kind of just topics that we all talk about that impact all of us in a non-formal way. So it's really a lot of fun. Yeah, it is. That's so fun. So can we go backwards a little bit? Joe, can I move back?
Yeah.
Okay. So Madelin, how did you did schooling in Barrie, and then you did your residency locally at Plantation, right?
Yes.
And then did you move right up to the area where you were working over at Westside with Dr. Spinner? How'd that work out?
So actually, times are so crazy, Jeff. At that time, remember, we didn't have enough residencies, right? At the time where we were in school at Barrie, and we knew we needed to compete. And the program that I applied for was at the time called Doctors Hospital, which then changed to Florida Medical Center, changed to Plantation General Hospital, and now it's Westside. Always the same director, always the same attendings. The same area, Broward County. So I was fortunate enough to recognize as a student rotating through many of the hospitals where these podiatrists worked, right? So like I tell the students, you guys are super lucky because you're getting exposed through just third-year rotations to meeting podiatrists that are in the same hospitals where you're rotating without even getting to an externship year. And so that sort of set the tone for me. I got to see a lot of these podiatrists at work. I got to meet them. And then most importantly, I got to see how podiatry fit into that healthcare, world. Dr. Spinner, has always been a big name. And I had, as a student, been in surgeries with him. And I really always admired his demeanor. He is a person that is very respectful of his residents. He will never pimp you and scream or humiliate. He doesn't believe in anything like that. And so I knew I wanted to get trained in that program. So of course, I did a lot of externships. I also did externships in California, but at the end of the day, I knew my first choice was that program. So I ultimately, become one of two residents in my year, and land the program of my dreams. Really, it was my first choice. I was very, very fortunate. And I, during my second year, get called in by an ortho group in the area. In the ortho group, Dr. Reitman puts a contract in front of me and says, Madelin, we want to offer you a job. And I said, well, I'm only a second year and I have one more year of training. And he said, that's exactly why we want to do this, because when you're done in your 3 years, we want you to work for us. And they were the largest group in the area. So I said, Dr. Reitman, obviously very honored, but I would like to be able to look over this contract and talk to my husband about it. Of course, I storm into Spinner's office the next day. And I'm like, oh my God, I mean, this is really exciting. But, I'm not even sure if I'm staying or going back to California. Nevertheless, to me, it's an honor that somebody would, want to set me up. I even said to him, you already have a podiatrist in the Plantation office. He goes, no, I found out you live in Miami Lakes and you travel every day. And we're going to open up an office in Miami Lakes for you. I'm like, okay, wow, that sounds even better. So Dr. Spinner said to me, Mad, look at this contract. This contract, if you decide you don't like them, will put you to practice in the ocean on either side of the peninsula. So I said, oh my God, I didn't even read the non-compete. I was just, blinded by that cool offer.
Right.
And a very, very lucrative practice and very successful. So, and all of those guys were my attendings. So they knew who the hell they were trying to hire, right? They knew what they were getting. So, long story short, Spinner's like, this is not good. You're going to work with me. And I'm like, are you offering me a job? And he's like, yep. Wow. You don't have to look. You don't have to search. So during my second year, I was extremely, extremely lucky. I started seeing patients in the afternoons, building up a practice for myself. By the time I started, I had seen patients second year, a part of second year and all of third year in his practice with him. And those people all became my patients. So I had a job with patients. It's crazy.
Oh my gosh.
And surrounded by the attendings who trained me. And during my first year, Jeff, all of podiatry, the only podiatry we were able to see was after 5 p.m. If you were on call, you saw podiatry. If you were working between 7 and 5, we were the first assist to ortho. It was an orthopedic heavy hospital and everything was ortho. And it makes me laugh because you learn so much, right? The body is attached. It doesn't matter where you're operating. You have layers and you need to know, where you are and how you need to make sure that you find the nerves and the arteries and the vessels in the area. But as I have been training, I feel like residents for my entire life, I always thought it was really funny when a resident would come and go, Dr. Ramil, we really don't want to do ortho. We don't want to assist ortho. I'm like, are you kidding me? It's so funny. They're like, we're never going to do that. We're podiatrists. I'm like, don't undersell yourself. You are learning from the plastic surgeon, the breast augmentation, the reconstruction, right?
Absolutely.
It's amazing. I can tell you honestly that not only did I grow as a surgeon, these men would give me the saw and I would be cutting bone for them on the knee. Like you give me the saw and we'd hand it to each other and we'd be cutting. By the time I was doing feet, I felt comfortable with a saw. And you closed everything. They're like, okay, Matt, close it up. The layers, so you learn so much, but you learn and you become a surgeon. You don't become a podiatrist. Mm-hmm. And I always try to teach that to my residents. You are becoming a surgeon and you are becoming a doctor, no matter what, in your area of expertise, right? And you are becoming the lower extremity expert. But at the end of the day, you are a doctor. And if you need to suture every scalp and every arm and every hand, when we were residents, we were the only residents in the hospital. Guess who they called to repair every laceration? The podiatry residents. So I know times have changed and now we share those rotations with residents of all types, right? But we were lucky enough that we were the only residents in the hospital at the time. So everybody wanted you, you know?
It's a great position to be in.
Yes.
Madelin, I wanted to give a shout out to the residency program. I mean, when I was at Barry, Westside was such a desired location. And I remember when I was in practice and I would go to a conference, if Dr. Spinner was there, I would definitely try to get in the workshop because he was just wonderful at teaching, learning new techniques and new equipment, new instrumentation and things. What a tremendous leader in our profession.
What I will tell you that for the rest of my life, I will be forever grateful to have trained under him. To work with Dr. Spinner was another honor because, Jeff and Joe, when you're in a practice and you're questioning yourself and you're like, am I doing the right thing? This is a difficult one. He's been to 5 other doctors. This isn't the everyday case. You start to question yourself. I know that we have a rapport with our residents that all of our past residents would call us and send me pictures and x-rays. Ramil, do you think we should do this? I have a difficult patient. What do I say to this patient? And so Spinner, Chesed, and I would have each other. Right. So he would knock on the door and it's like, Mad, come to room 4 with me. And he's like, what would you do? And he would tell me nothing other than, hey, Mr. So-and-so, this is my partner. And he wanted a non-biased opinion without telling me what he was going to do. And it was very funny. I trained under him and Fred trained under him. So he trains Fred, keeps him, trains me and keeps me. And we think alike. Of course we think alike. But at the same time, I was always sort of like the female who would question him all the time. And he would say, because I said so. I'm like, that's exactly why I'm going to question you, right? So it was back and forth. There was always this thing about him being in the OR with me and saying, man, you know that girls should not be holding power equipment. I'm like, too bad because you taught me, So it was amazing fun times. But times that I couldn't be more grateful. Times where there was just so much work. And my God, we had 38 podiatrists on staff in our hospital, Jeff.
Wow.
In addition to all those orthopods that we had to assist. And therefore, that is how Westside became Westside. We had an amazing leader. He's done it all. What hasn't he done? We had an incredible role model. The humiliation, the pimping, the making somebody feel badly or inferior. Never his tactic. Never. And so never had to raise his voice. He would look at you like your mother looks at you and you knew you did wrong, right? But we worked hard, Jeff. We worked long hours, sometimes with, a few hours of sleep.
Sure.
And it's crazy how times have changed because now our residents get 4 weeks of PTO.
We all know that early detection is the most important determination in improving patient outcomes. Bako Diagnostics remains committed to supporting you in your role as the first line of defense in diagnosing lower extremity pathologies. Bako Diagnostics, helping podiatric physicians keep America on its feet. Well, Joe, weren't you telling a story the other night about a big case you wanted to go into and your residency director sent you home because she had worked too much?
It was right when all the work hour restrictions were starting to come and they were tracking. So we weren't yet held to the standard, but they were actually tracking our hours. And we had never had to do this. And I remember there was a whole day of cases and I was on, so we took primary ortho call.
Right.
And I can't tell you what an invaluable experience that was. In fact, there were 2 board questions that I still to this day remember I answered correctly only because of orthopedic experiences, not necessarily podiatry ones, but that's a different story for a different day. But it was that, 36 hours or whatever it was, I had reached whatever their defined metric was for threshold. And I recognize, yes, like from a safety perspective, but that's not me doing, like, I'm here with an attending. And I was so upset that he was like, I understand you want to stay and I would love to have you stay, but this is now going to be on a record and I cannot do it. And I was so upset by it.
Wow.
And it is a different world now. That what I think is an interesting shift is helping frame what this work hour restriction should look like. Because if it is also like I'm clocking in and I'm clocking out as a resident, you are completely missing opportunity.
Absolutely.
And I don't know if we want to go down that road, Jeff, or not, because I also want to hear about your fellowship. Like, you did a fellowship in Spain, and that's a really interesting thing.
Yes.
So like, I kind of feel like I want to keep talking about so many other things, but I would love your take on now dealing with a younger group of learners that is also a different generational shift. How have some of those discussions gone or experiences gone for you? What is your take on some of that?
Honestly, for the most part, I would say that in terms of, going back to residents, not students, right, Joe? There's always a resident that will somehow want to do less. I mean, it is what it is. And we were very clear on our position and name in our hospital. I mean, we've been there for 40 some odd years. And even we've gone through so many CEOs, and they come around and they have no idea what a podiatrist does. So ultimately, it was just about, I tended to do that a whole lot. I became the clinical director of the program, which meant that I loved rounding. So I was there at 5 o'clock rounding with all these residents, teaching them how to round, how to write a note, how to think and prioritize everything that's coming at you, because now you have the ER calling you and you have a case that you have to set up and you have to be here for this. You have to set up journal club and whatnot. So it was always about, guys, not only do we have to prioritize, you also have to have an attitude of being willing to help. Because what happens often is, since the history behind the OR director and the person who ran the hospital OR was in talking, oh, we need an assistant. They're like, oh, call Ramil. We have a resident, right? That was the attitude. And I told them that. I said, guys, they literally will call me if you become known to them, if you start to build a relationship with them, they will soon not only call you for where they need you, which you're going to learn no matter what, but they're also going to call you and go, hey, we just added an ankle, and the doctor hadn't even called anyone, but she's calling to make sure, because she knows our interests. So it went both ways.
Yeah.
So I couldn't impress on them enough that relationship building in a hospital setting was tremendous. The nurses would back you up. The nurses would say, cardiologists go, okay, I have a consult. Who do I give this to? And immediately that nurse would think of, believe it or not, they think of residents who have built a relationship with them. Or they would call me. They're like, Ramil, we don't want to call you and bother you, but we have these consults here. Do you want them? I'm like, of course I want them. And they always thought of me as like the little chicken with all the chickies following her. That's the running joke in the hospital all the time, because mainly it was all men podiatrists, and we had a few females, but they weren't visible because maybe they brought a case once in a while and their offices were not near the hospital. So, I was there every day before breakfast, lunch, and if we had to come back after dinner, dinner would be at the hospital, and then let's go see the next consult and whatnot. So, it has been, to me, I would say those situations where I've had a resident question, like, I don't want to do that, it was rare, but somehow, even though they may not admit it to you, somebody would throw them under the bus and say, so-and-so said this, right? Even their own co-residents. I remember the last time I had this conversation was one of our residents. I don't know. Do you know Charlie Arena, Jeff?
I do not know Charlie.
Charlie. So Charlie was a part of ABFAS for many, many years. Okay. And so Charlie's son became a podiatrist. And Charlie's son became one of our residents. And I remember him sending him to my office and go, hey, my kid's in school. And he's starting to look at residency programs. And Tom, who is now practicing, came over to the office, and he's just sort of shadowed me for a few days and followed me everywhere. Anyway, the guy was fantastic, and he ended up with us. And Tom would come up to me and go, Dr. Ramil, I can't believe my co-residents don't want to do an ortho case. And he's like, you know how many ortho cases I've done in 4 days? 16 after hours. Right. He's like, they have no idea how much I learn and how much I apply to my own cases.
Right.
So it was funny. And you know what? I had an attitude, Joe, that at some point I would say, guys, don't let me get disappointed, because the one that is eager and hungry, I will never stop teaching. The one that seems uninterested, I'm not going to go out of my way. Right?
Yeah.
Totally fair.
Yeah.
I mean, because I think we've all kind of experienced that. You go to school, you do all these great externships or clerkships or however you want to declare them. And then you do a great residency program. Then you go into practice and you work with a great residency program.
Yeah.
One of my greatest challenges, Madelin, frankly, in academics is dealing with students that aren't motivated and then trying to light that fire under them. And Joe and I have had this discussion. How much, Joe? Like nonstop. Like I'm trying to meet them where they're at and get the motivation going and try to. Joe, you describe it better than I do, because I'm kind of old school. I'm like, really? Because to your point, Madelin, we're here to help, but if you're not interested, we're not so helpful.
So I would say to you that I was very disappointed, and I would say probably for the past 5 years, Jeff, I became more and more disappointed with the uninterest. So the same way you are describing the student who is not motivated, that same student moves on to become a resident. And how do you know that in a 20-minute interview? Yeah. That is why I tell students, guys, you don't have any idea the value of doing an externship and shining, because I rather take an extern than take the 20-minute interview that put on a show. He could have put on a phenomenal show for me.
Yeah, all day long. So, one of the challenges, Madelin and Joe and I have talked about this, because the students have changed. What they want out of life has changed to a point, right? And Joe, you are very articulate about this topic, because we're dealing with students all the time and you're interfacing with them. Do you mind just sharing some of your experience of how we meet them where they are? Because they aren't just lazy, right? I don't know if that's the right term to use.
I feel really passionate about this, actually. And not wanting to, paint with really broad strokes, for sure, because on both ends, you have your overeager Labrador students and you have your I'm going to do the minimal necessary to kind of get through. But I think those are right. So there is a different kind of spectrum in the middle. But what's been really interesting for my own scratching of an itch is figuring out motivation is an internal thing. Like I cannot motivate them. They are adults. And this is something that when I first started in academics, I would get so frustrated. Like, why can't I convince this person to work harder or do better or whatever? And it step back and have that emotional intelligence that this is not my job to like motivate the student to do something. My job is to show up and give them everything I can possibly give. And maybe I can spark some curiosity. Maybe I can inspire them to want to go into something else deeper, ask the kinds of questions, but I cannot motivate them. And I think perhaps that switch in my own thinking really helped me understand the learner a little bit better and ask them better questions. And I love at the very beginning, Madelin, you had said this, like, if you ask them, they will tell you these students are wonderful and they're brilliant, but medicine is different. And they see that medicine has become very transactional. The ownership and autonomy that we used to have as a physician is significantly different now than it was even 15 years ago, let alone, 20 years ago. And they've watched that shift. And so I think they are looking at this through a different lens of, I'm open to doing this thing and I have an interest in it. So I'm going to pursue it. I find it highly valuable, but I am going to do it on my terms because they're going to define my value and I'm going to show up and do my job. And then I'm going to go home. And they are looking at it through a different viewpoint than the way that I looked at it, which was my calling. This is a craft. This is something that I want to continue to strive for excellence, knowing I'm never going to be perfect, but I'm going to constantly try to get better. And so helping kind of align these two ideals, I think is a really interesting phase because I think that there is a lot to be learned from a group of young students that have a really good grasp on the kind of life they want to live and how they want to try to build support blocks to create that. But what they're missing is the framework to get there, built up with an expectation perhaps of you can go out and be anything you want to be and you can do, anything you want to do. They've lived with helicopter parents that have sheltered them from having to do certain things and try things or fail at things. Or they've grown up in this digital world that exposes them to everything, that they just have a whole different lived experience than what I've had. But I think trying to help put that framework, you don't just get to show up and have it. Just because you check all the boxes doesn't mean you get it. And I think that's the part that is a little bit of an interesting struggle. Because for a lot of their life, you just show up and keep doing things and you get it. Like that's just kind of how life has shaped out when you're 23, right? Like that is the way it has kind of worked out for them. And so suddenly now you're put into a position where if you're continuing to be told, oh, you're all going to get a residency. Oh, it's going to be great. You're going to do fine. Then they've put in a framework of like, I don't have to work that hard. I just have to show up. And I think that's wrong. And so I've become very intentional about how I say certain things and how we map out what they want their 5 years from now to look like. And then how do they build the life to support that? Because it's not just showing up from 9 to 5. It's not taking the ortho call. It's not just doing the bare minimum to check the box to move to the next step. That's not how you get the life that they want. That's been, it's been an evolution over time, but is that kind of what you're thinking, Jeff? I don't know if that was very eloquent.
It is because your efforts to deal with that challenge that Madelin's talking about with residents, or we've been talking about with students, is a core challenge for me. I mean, it has been a challenge every day because to Madelin's point, interviewing for residents or interviewing for students, for 30 minutes, if they've got the grades and they've got the MCAT score and they come in for 30 minutes and they come to school and then they're not applying themselves, that's not what either of us bargained for, us for them or them for us. So it's a challenge sometimes. And I'm Madelin, to be honest with you, I'm still struggling with that on many fronts because to Joe's point, it's a craft, it's an art, it's something that you for 4 years you give it your all, and then for 3 years, I always tell our students, for 1,000 days in residency, you better learn something every single day because that 3 years goes by so fast. Absolutely. So anyways, I think it's a great discussion because I think it's the cuts to the core of challenges in academics right now.
You know what I've noticed, though? I've noticed that with all of what Joe said and with my experience, I used to be a teacher before I became a podiatrist. And my mother used to say to me, I used to say to her before I went into the classroom, well, Mom, what if they don't listen to me? What do I do? And she is like, listen, kids will listen to you when you speak to them. You dance for them. You get on your head. You dance on those desks. You do whatever it takes. You're going to capture their attention and they're going to be magnetized by you. She would say that. So long story short, I'm 22 and I'm teaching high school in my old alma mater. So I went back to Glendale High School where I graduated from, and I was teaching AP Physics. That was the only course they gave me that would be like the smart kids. And everything else was like the life sciences. And I said to Mr. Harvey, my old principal, I said, Mr. Harvey, I want to teach anatomy and physiology and biology. He's like, girl, all of the people that were teaching you are still here. We're not going to get rid of them. You're going to teach the kids that nobody wants to teach, the low learners, the life sciences. And what I found then, and I would apply that for the rest of my life, and I would teach that to every professor, including Barry University, is because I've seen it with one of our professors. I see exactly what my mom taught me. When you are passionate and when you are excited about what you are teaching, there is some type of, you're contagious.
Yeah.
You're contagious. Your excitement, Joe, these kids, I don't care what age you are, because it becomes a part of not only she makes it interesting, she likes what she's doing. What is it that she does that I want that? Like, we're humans, we want that. Yeah. Because these kids would say to me, you know what? I want to be like you one day. And they were the low learners. They were the kids that were failing, the athletes that were barely making it. And so I'd say, you know what? I'm going to tutor before school. I'm going to tutor during lunch and after school. Who's going to show up? Nobody. And I'm like, you all better show up because you're failing and I'm not going to let you play football. So one would show up, two would show up. I would teach them. You get these kids from an F to getting C's and B's. And there was this pride. They're like, Ramil, don't tell my friend I came here because I'm like a nerd. I'm like, you should be so proud. Do you know I would have my before school and my lunches were packed. I'd have 45 kids in there. They all started to tell each other. They all started to do well. And all of a sudden they felt proud. And they could see what they could achieve. You know, that is a different level. That is high school. Now I have a doctor, Dr. Azari. Jeff, did you ever work with Dr. Azari?
No.
He teaches gross anatomy. This man, when he speaks to me about his class, I'm captivated. I just want to sit there and learn because he's so excited about what he does. Yeah. And do you know that ever since I started working there isn't one student who doesn't say, if they could all be like him, we love his class. We don't care. He gives us like 10 extra hours of lab, we all want to go. And he then tells you that students want to learn. He is like, they're hungry. They call me, they text me. I don't understand this. He is like, I'm excited to teach them. And so something's going on with the way this professor is teaching, that no matter how hard this subject matter is, they're intrigued, they're captivated, they're interested. And at the end, they're like, my God, this is something I'm supposed to know. The students will tell me, I need to know gross anatomy for the rest of my life, and I need to know it in surgery. And he makes it so interesting and simplifies it for me that I love the class. And so if I could, I think it's how some of us come across. When you and I, all of us go and listen to speakers, it doesn't matter if they're motivational, if it's at church, or if it's at ACFAS coming for the weekend. You hear the snores, people fall asleep. There are other speakers that you're captivated by them.
Yep.
And it's a gift. It's a gift,
It is a gift. Joe, you got that gift.
That's awesome. I can tell the way she speaks.
Well, I don't mean to put you on the spot.
I do not lack. I'll just say that.
Let's go with that.
I'll take that.
I think that's
I've never
fabulous.
been accused of being unenthused. So,
well, to your point, Madelin, fresh blood, enthusiasm, new slides, up-to-date research in your presentations, all of those are captivating. If I'm going to give a lecture and there's a slide that I haven't changed in 10 years, the students know it, right? They know it. And you're not going to get their engagement. That's for fact.
But do you not agree that this professor who uses the same slides for 10 years, he is bored himself?
Oh, totally. 100% agree.
So I feel that when you are a professor and you start to change it up, you get excited as well. I mean, you have to freshen up.
Totally.
It comes across very differently.
Yeah. Hence the challenges with tenure.
Yeah. Well,
that's a whole nother topic.
Yeah. I can tell you that with my own son, I have a very good rapport with my son. And my son calls me every day from school, and he will, first thing out of my day is like, how is your professor? When he first starts a semester or a quarter, how is that professor? Did you like him? Didn't you? Why didn't you? And every single time, Jeff, he'll come home so excited about that person who is not the tenured in practice 25 years, but is the banker who's the CEO of the bank, who loves to teach and comes and teaches one or two classes in the school. And so he is using the textbook and he applies it, but he's like, Mom, he just constantly refers to the real world with case scenarios, right? Yep. Think about us when we are bringing in that clinical case scenario to that didactic, boring moment. If you apply the biochemistry that I agree with you, Jeff, like that's not my forte or my strength, but you apply it to what does biochemistry mean to gout? All of a sudden you're like, oh, wow. Right. And so
I've got a fun story for you. When I was in grad school, and I'm not gonna, reveal any names or anything, but I was doing some research and one of the professors was there and I was trying to engage, right? Relationship building. And he said, Jeff, the university would be a great place to work if it wasn't for the students. I pulled out of the program. I left the program. I'm like, I don't want to be here.
Wrong place.
Wrong place for me. And then,
Jeff, that reminds me, as my 22-year-old first job as a teacher, I would go to the teacher's lounge, right? during our break and our lunch. And they all sat there and they complained and named the students. It was all. So a few weeks into it, I said, I got to stop coming in here. This is so negative. That's why the kids are not excited. And that is how I started having lunch and breaks in my classroom. And that's how my tutoring came about. And then they would say, well, when are you going to come back and have lunch with us? I said, I'm not. The kids would even invite me to have lunch in the quad outside with them. I'm like, if I go to the quad with you, then I can't teach you. And, we're like having these working lunches because I'm tutoring you. So it's wow.
And that's incredible. I mean, this is so fun. We've already been going over an hour, Madelin. And so what I'm thinking is, I think we're going to have you back on Dean's Chat to continue some of our discussions.
I would love that. I'd love to share that whole incredible international experience with you.
Yeah. I know. I've got some lists of things we didn't talk about.
Yeah, we didn't get to director of research or anything.
Oh, we didn't do any of that. But that's fun. I mean, that's what a podcast is all about.
Yeah, that's right.
So, Madelin, I will see you Sunday.
Absolutely.
Looking forward to it. And Joe, any last words?
No, thank you so much for your time today and being so flexible to join us. And I look forward to connecting again, probably at FACFAS coming up pretty quick.
That's great. It was great seeing you both. Thank you for having me.
Well, you're so welcome. And we got lots more to talk about. And we'll do a Dr. Ramil Unplugged Part 2. How's that sound?
All right. Great.
All right. To all of our listeners out there, if you're listening on Apple or Spotify, please give us a 5-star rating, and even better, leave a comment or two. And if you're watching on YouTube, by all means, become a subscriber. Joe and I will continue to bring leaders in podiatric medicine and surgery like Dr. Ramil. Congratulations again, Madelin, on being the dean.
Thank you.
Thank you all for
having me, and thank you for your warmth. Really.
It's so great to touch base. All right. We are going to send you a Dean's Chat mug. Let's see. Here we go. So Dr. Arrett, one of the new deans up at LECOM, he said, start your day the Dean's Chat way with our mug. And so Joe and I have kind of adopted that as our motto with the mugs.
Okay. Will do.
All right. Everybody. Have a wonderful week. Cheers. Bye-bye.
Thank you. Bye-bye.
Bye.